Hi there, my name is Beverly, and I am the co-founder of Silverleaf Practice Management Solutions. And I'm here today to tell you about the three software programs that I recommend that you get when you're starting up your private practice. So you have options, okay? And I know if you've been out there long enough, you've dated all the different EHR systems and you're trying to find the perfect one. Well, unfortunately, there's not a perfect one, but IntakeQ is great, and it's real close to being perfect, okay? There'll be a couple of things I would tweak with IntakeQ, but we'll get there later. My background, I'm an RN, but I have an informatics background as well, so I have built in several different EHR systems, templates, you name it, I've put it in an EHR system, and I've built in big hospital systems and in small private practice ones, and I can tell you they all have their varying degrees of complications. The first thing that you'll find with some of these EHR companies out there is that when they do a presentation for you, they're going to sell you something with all the bells and whistles, right? It's all put together. It's great. You get the box and it's got one bell and two whistles in it. And you're like, where are all the rest of everything? Well, they're like, well, it's there, but you have to build it in. And I don't know about you, but some people are not very technologically savvy and they're like, oh my gosh, now I have to build all this stuff in. Well, that's where Silverleaf comes in. And I have trial and error different software programs, and I can tell you that this is by far the best one that I have found, or the best combination I have found. And I can give you resources or references to folks that I have set up in this same exact system, and they can let you know how well it's working for them. But the trifecta of the three systems is IntakeQ, Spruce Health for your communications, so the IntakeQ for your EHR, Spruce Health for your communications, and then MD Toolbox for your e-prescribing. And if you get all three of those systems, it does everything you need it to do for less than $150 a month. So it covers everything. So for example, I'll go through IntakeQ real quick here in a second and kind of show you the highlights. But Spruce Health, I'll have another video on Spruce Health and kind of explain to you about that. But the reason why I found Spruce Health is because I was doing practice management for my boyfriend's practice when he first started, and I was doing it at the end of my day after my 40-hour-a-week, job. And I was coming on and I was checking emails and checking portal messages and checking phone messages and voicemails and all that. And it was about to drive me crazy, and I was afraid that I was going to lose somebody in all the communication process. And I thought there has got to be a better way. And that's what led me to Spruce Health. Spruce Health brings everything in one place. It brings in the faxes, the phone numbers, the emails, the text messages, HIPAA compliant text messages, everything in one place. You can fax out easily. You can even talk to each other on the same platform. So if you've got a virtual assistant or a biller or even another practitioner working with you, you can converse with them back and forth through the app too within the patient's thread. I mean, it's just a really overall good program. And I will have another video on Spruce Health by itself. The one thing that IntakeQ is, for lack of a better word, lacking is an e-prescribe software. And I recommend providers use MD Toolbox. And it's just mdtoolbox.com. You can go check it out, but you can prescribe controls through there. And I think it's $38.99 a month at this point. But it's not hard to do that along with your IntakeQ as your EHR. So it's in two separate systems, but it works perfectly fine together. And you will find that if you want, now I know that's a deal breaker for some people. EHR is a deal breaker, not being in the same system, and that's fine. I mean, that's your own prerogative, but when you're first starting up your private practice, and even going forward and managing your business, you want to keep your overhead costs as cheap as possible. And I can tell you with some of these EHRs, they're gonna, you have the integrated EHR, that's great. Sometimes it works, sometimes it doesn't. But it's not worth the cost that these other bigger EHRs will charge you. Some of these EHRs will charge you $499 a month plus, to have all the everything, and you don't need all the everything sometimes. They will also tell you that integrated labs are available in their EHR. That is not necessarily true because not all the lab places are going to play with you because you may be a small provider. They want people that are going to send them lots of patients. We have had that problem with my boyfriend's practice. So, just because that's a perk to that EHR, it's not necessarily always a perk. And then sometimes these EHRs take a long time to build and set up in the background. And that's one thing that IntakeQ does not take long to do. And we have done a lot of the work for you. So if you see on my screen here, you're going to see all of these forms. And if you go and get a free trial of IntakeQ, you're not going to see anything in here really. They have a small little library, but it's not really set up to providers. You've got a huge ability to build pretty much anything you want to in here. So Silverleaf has taken, and we have built in a bunch of screening tools for you. You've got an online intake form. You have a request for appointment template that you can put on your website. You can actually do screenings one of two ways through IntakeQ, through like a form where they would send it to you and you would confirm the appointment if you want to confirm it or decline it. You can do it that way, or we can build in the screening questions when they book their appointment. So that's a cool thing. So you can see all the scales and stuff here. The scales will calculate for you. So as they're putting in their screening, in their screening tools, putting in their answers, it'll calculate your totals for you so that you have that. These are all the consent forms that it comes with when we do it here for you with Silverleaf. So you get all the intake forms, all these screening tools, all the consent forms that you could possibly need, and then the note templates. So you'll get a psychiatric evaluation, or if you're a medical provider, we can customize that to be medical, or any other provider actually. You just give us a format, we can customize that for you. You get a follow-up evaluation. You get the template to make a provider phone call, work excuse, lab testing orders. That's how we do our lab tests. You'll get the ESA letter, the nurse assistant call, the collection payment contact note, late cancellation no-show note, medical records request note, and then you get a couple of scales here along with your aims. So there's a lot that you get that we built in for you that'll be taken care of. Let me show you their bookings area. So if you go into bookings, this is what your calendar looks like. And it's super easy to build in your settings. So you go into booking settings, you pick what type of appointments that you want in here. You put your time frames and stuff. This is a test system, so it's not exactly the way I want it to look. But these are your different services. So you come out and go into your payments. It attaches to Square, so Square does your payments for you. They do charge a fee. All of them do. All of your credit card processing merchants are going to charge you a fee. And if you sign up, I can give you a link there that'll give you some free processing. That'll help you out a little bit. And then if you can refer other people, then you get more free processing. But one thing IntakeQ also will allow you to do is to require a credit card when they're booking. You can make them put a deposit down. You can collect the whole amount when they book. And if you're doing a cash pay practice, you could even schedule it to go in and just hit all the credit cards the day before the appointment or how many hours before the appointment. So that's another perk. It does have online scheduling. So when you go into the online scheduling area, it shows the patient information or patient appointment types, and you're actually just going to see these. So that we were playing around in this, but it's got all these different visits. You were only going to see the initial patient evaluation and the follow-up evaluation, but the patient clicks book now. You click on it, it pulls up all of the times that are available for that appointment type. You click on it, you have to put the patient's name and stuff information in. This link can actually be put on your website, so when a patient clicks your website to book an appointment, it'll take them directly into the online booking link. So you have online booking, you have the ability to take the credit cards, do the self-scheduling, invoicing and billing can go through IntakeQ as well. So their billing module for their insurance claims attaches to Office Ally. So that makes it super easy. You don't have to go into Office Ally to do your billing. You do it all through IntakeQ, and your things come right back in after you've billed your appointments. And then, like I said, all the automatic screenings and stuff that are built in, you can send these to patients on the fly. So if you're seeing a patient, you want to send them this, you just click Send to Client and put the client's name in, and it's just going to automatically send it to them. When the patient books their appointment online, it's going to automatically send them all their consent forms. It's just going to go to them like magic, and then they sign them electronically, fill out their intake form, and it comes right back to you in their chart, completely done. There's no extra emailing any consents or doing any of that stuff. The system will do it for you. This system will even send your patient a happy birthday email. I mean, that's how much automation is in here. You can do process automation. So if a patient clicks a specific button, so for example, if they say they need a super bill because you don't take their insurance, if they click a certain button on their intake form that says, I need a super bill, or whatever question it may be, it can automatically put a tag in the patient's chart and send you a task that says, send this patient a super bill. I mean, this system is so easy to maneuver around in, and it's so easy for your patients to maneuver in, when they get an email to fill out their paperwork. So easy, y'all. And that is huge when it comes to all these EHR systems. Ease for the provider and ease for the patient. So IntakeQ is by far my selection for an EHR. I'm happy to answer any questions for you. I do 15-minute free consultations, and so you can reach out to me. We can talk about this a little bit more, and I can even show you more in depth IntakeQ if you want. But this system, y'all, for $59.90 a month, is super easy and it's cheap compared to, in addition to what it all does. And it looks really professional on the patient side. It looks great when you print it out. That's another thing that I've run into across the years is, that when you print out the medical records, they're awful. I mean, you can't read them. You don't understand what they say. This looks very clean, very nice and neat. It looks very professional. So Intake Q for the win for EHR system. Spruce Health for your communication system, which we can also get you a discount on if I didn't mention that already. And then MD Toolbox, MD like doctor, mdtoolbox.com for your e-prescribe. Those three things together come out to less than $150 a month, and you've got everything you need to run your practice. So reach out to me. Let me know if you want to talk about this a little bit longer. We'd be happy to set this all up for you and get you going. We can usually get your system set up in less than 45 days, and we can even do your website, credentialing, anything else that you need to set up your private practice. But I just want to tell you about my fabulous trio that I do for my providers, and hopefully you guys will appreciate this. And again, let me know if you have any questions. Have a great day.